A very good evening to all of you. Thank you for waiting, and still more people have to join. I'm Dr. Arun Thejaus. I welcome you all for our online yoga training here in Nitte Center for Integrative Medicine and Research. So, this online training can be used for healthy people, COVID post rehab patients, asymptomatic COVID patients. For this purpose, we started this live session. So today is our first session, and it is very tricky. Usually, we train people on site, like 10 or 15 or 100 people, whatever. We are able to correct them and guide them. But in online platform, it is not at all possible to monitor you in any ways, even it is in any other online Zoom or Google Meet or anything. So you have to be very careful about yourself. Like when you do yoga, there is no much risk involved, but still you can fall, you can slip, you can get muscle catch. Some people can get fatigue. Even those who have, some other disease, for an example, vertigo or any other health issues, they can also have some complications. Making sure those complications should not affect you, even though we are doing this online training for a good purpose, it should not turn into any bad things like you are in trouble. That should not happen. So get yourself comfortable in place. Also, one more thing, either if you are using the mobile or desktop or TV, and you make sure that it is close to you and it is not disturbing, or it is the connection is not lost. You have enough data, all this. So basically, I would like to talk to you a little bit about yoga today because it's our first session. I seriously don't know how many are doing for the first time and how many are doing it already. Whatever it is, there are some few basics that we need to understand when you go and practice yoga. Before that, we need to understand certain things. Number one, we are doing now, or we are yoga abhyasa, lots of physical postures or breathing technique or relaxation technique. So, how it is differ from exercise is that what we have to be very precise. Exercise also gives you very good many advantages, but how that differ from yoga is three things. Number one, when you practice yoga, you have to be focusing on your breath. So breath is a key factor in practicing yoga. Two, your body movement. The body movement are synchronized with your breathing or very systematically driven movements are in yoga. And third thing is attention and focus. So you have to have better attention and focus. For that, you can avoid which disturb all these three. For an example, if I wear a tight t-shirt, which discomfort me all the time, so my attention goes there. Now my attention is looking it in the online. So my attention is gone already. So I may be just training you. I may be not having super attention in this online platform or even you. Second thing, simple, like you choose a clean and neat place, a ventilated area, which is all have some boundary and limitation in online again. So you have to choose such area and places which is well clean, neat, and your bowel and bladder is empty, and you are not, you just finish your coffee and then you do. It's not like that. Or after you practice your yoga, take some 30-40 minutes for your dinner. It's like that. So your body should not have any discomfort, because if you have any discomfort, even maybe some smell, if smell comes, your attention goes there. You don't get attention. So if it is tight clothes, your attention goes there. If you have a mobile in your side, now I have for this online, my attention is there in my mobile, who messaged. So all these things you have to take care. Then only you can do a very good yoga. Before session, another 5 minutes I will take all of yours to understand some a little theory part of yoga. This in any class, before I start any class, I would say this to my clients or patients, whoever I'm training yoga. So yoga is almost 5,000 to 6,000 years old, but we Homo sapiens are here almost 2 lakh years. But last 5 6 years, 5 6,000 years back, the ancient people, maybe this Indian region, have developed this module for not for health purpose. That's true, but it's for spiritual and many other aspects. It's a way of living. It's not that you have to do daily abhyasa or some exercise form to practice yoga. Yoga is not that. Yoga is largely philosophy, but we are now using some components of it to improve our health. So that's a small part of it. So they have developed one theory which has uh, references in Upanishads. So this theory is called Pancha Kosha theory. This you need to know before you go into any yoga practice. This Pancha Kosha theory. Pancha means five, Kosha means layer or cell. Pancha Kosha theory, layers of existence. So 6,000 years back, this rishis or sages understood the body in that way. So that I will explain. So five layers, it's like onion. First layer, second layer, third layer, fourth layer, fifth layer. So the outermost layer is called Annamaya Kosha. Okay. Anna means food. The existence made up of food. That's what this body. I'm almost 73 kgs, 74 kgs. I was just 1.5, 2 kg when I was born. And this body weight I gained, this mass I gained from the food I take. So Anna built body. You can see, feel the existence by looking, by weighing, by measuring the body. You can measure it in that way. That is first layer called Annamaya Kosha. Okay. Second layer inside that. Now you can test the body parts, everything you can test. All the machineries we can use it. But I'm talking about 6,000 years back. What was their thinking about love existence? Second layer is called inside. It's not actually you can cut open and see, but inside is called Pranamaya Kosha. Pranamaya Kosha is nothing but the force, life force. Majorly they say prana is here, like lungs, the air we take prana. If there is no air, our primary food is air. If there is no air, you are gone, you are dead. That's how one way we understand that there is no life in the body, but there is no air. So they largely understood in that way, prana maya kosha, which is keeping you alive. Okay, that nowadays we can check it. Of course, we have pulmonary function test, many other tests where how much air we are inhaling, exhaling, how much is remaining. All this we can say, and there are many research studies prove that yoga is one of the best one to as a cardio respiratory exercise form. Like it can improve your lung function, various breathing techniques, which I am going to teach you soon. Today will be that. So second level of existence is pranamaya kosha. Okay, and third layer, which is inside, okay, which is first layer annamaya, second pranamaya, third manomaya kosha. Mano means mind. Do you have? Yes, we have. But can you show it where? So nowadays we say the brain function is manomaya kosha, right? Mind is brain function. Not exactly. It can be debatable, and it's okay. Brain functions, manomaya, but we can't point out where it is. So this first three is interconnected. Okay, annamaya, pranamaya, manomaya. Manomaya is mind. Largely, it is called mind. This is interconnected. How? So if I run 100 meter with my physical existence, which is annamaya kosha, my respiration changes. So which can influence my prana. And then the third, mind. It can influence mind. How? If I fall or I fear, all those, for an example, I ran, I saw police, and I don't have mask. There is a fear factor for me, right? So it's interconnected in that way, in reverse way also. If you have a fear, your respiration changes, you may even get tremors. Small kids, even in your dream, you can have problems like fear and mind that leads to the psychosomatic disorders. That's there. Okay. So three layer. Fourth one, I'll finish in another 2 minutes. Fourth layer is, if this three is intact, you need fourth layer, which is called Vijnana Maya Kosha. Vijnana means knowledge sheath. It's there. Where is the knowledge? It's all together. So knowledge sheets. If you have right knowledge about any subjects, then you can have no fear. If you study your subject very well, you don't need to be scared to fail the exams. So you have that right knowledge. So that will reduce your anxiety or depression, tension, all those mind related psycho. And also, if you have a better understanding, you will have that confidence, which even will reflect in your body language. So, all this for Annamaya, Pranamaya, Manomaya, Vijnanamaya. If you have this four in shape, then you have fifth layer, which is just fancy one, which is really existing or not, I don't know. Which is called Anandamaya Kosha. You will be happy. So it's called Anandamaya Kosha. So the fifth one is the target. For that, you can go to gym, daily workout, and you can have your physical body so strong. I have a friend who is built so well. He was very thin and built so well, and his confidence is in different level from the beginning when he was like this and this. So that's what the five layers. For this five layers, you may be working or we are working maybe what first two for little breathing exercise, which is for pranamaya kosha, for improving the lung functions, physiological functions, and maybe some physical posture, bending, twisting, all this is for your physical level. And maybe you can give some meditation and relaxation technique for your mind. So, and then if I'm able to guide you well, give you right knowledge, that's a fourth layer. You're learning something new. That's always good for the brain. So, fourth layer. So, Vijnanamaya. So, my work is just to give you some new informations in terms in yoga field. So I'll be giving some information and I'll be training you. It is not a section that you're literally doing from starting to ending. No, it's a training session so that you learn in another 15 session and then you practice by yourself by June 21st. So, any of these disturbances, physical disturbance or physiological changes, which is pranamaya, manomaya, any worries and things, and you don't have the right knowledge, all this can put you into so many problems. So right now we will start our if if anybody is not received the message and things, and if the call is, we understand some number we have given, the call is coming. So right now unable to take the call. We'll get back to you soon. So let's start our practice. So always you need third layer for putting the practice. So make yourself comfortable. I think you are in your place. You are sitting in a floor. We have kept a mat and sit in a floor where it is little free and ventilated and things. So I'll train you. You can sit in any comfortable position. So anyway, if you are above 60, please take the chair. There is no problem if you take a chair and do it. If you are unable to sit down like this, you can sit whichever is comfortable for you. So I can sit it so easily like this, half crossed. And if you are sitting, make your back, neck straight and hands on knee. And then before practicing the session, we have to do number one is preparation of your mind. For that, you can close your eyes. Now you will just listen me, don't look at me in the screen. You just listen me, keep the mobile or device which is in front of you and then listen me. Close your eyes. When you close your eyes, you have removed lots of distraction. Now your distraction is just my voice. Most of the distraction in front of you, maybe your family members are looking at you. That's everything is blocked now. If you have closed your eyes. After closing your eyes, just focus on your breath, which is second layer, pranamaya kosha. When you focus on your breath, you get better concentration or attention. Normally we breathe 15 to 16 times and try to bring it as slow as you can. You don't need to deliberately breathe slowly, but it becomes slower. Just 1 minute, keep your eyes closed and just focus on your breath. And prepare your mind, give auto suggestions like you will be regularly practicing yoga or exercise, or you will develop a habit which is beneficial for your lifestyle or for your health. Once you have completed 1 minute, you can just rub your palms. You can, before opening your eyes, both the hands you rub it and make it warm. By rubbing both the palms together, you make it warm. Make it very warm, in fact, and put it over your eyes and give a gentle massage over your face, your neck, and your hands, and then open your eyes. Okay. Now stretch your legs. Those who are aged, they can sit in chair. If you can bend it like this, well and good. I'll teach you how to from ground get up. So I was sitting in stretch, put the leg bend, then knee, then take one knee in front, raise up. So you are in standing position. So you can have a support. Today, before practicing any exercise, it's evening, it's fine because we have mobilized from morning to evening, we walked and did all this. Our joints are mobile. I mean, its range of movement would be well and good. But when you get up in the morning, system want take some time to adjust. So it's better to learn joint mobilization. In yoga, it says Sukshma Vyayama, minute exercises. So that's for mainly focused on joints. So which all joint we are going to focus today is one is neck, shoulder, elbow, wrist, and the small joints, especially for morning. Now it is fine, it's all mobile. And your spine, and then knee, ankle, and toes. So one by one, we will learn to mobilize it well today, and then we'll relax. That's what will be the class today. But I'll teach you this mobilization of joints that you should learn and keep practicing. Maybe morning, tomorrow morning, some 10 minutes you do. And entire your yoga session should close in 30 minutes, 40 minutes, not 1 hour, 2 hours. 30 minutes, 40 minutes is enough. Before that, I have got a question I got to read. I think it is important. Hello, sir. I'm suffering from vertigo. Many friends told me try yoga. That will help me to overcome this problem. Can I do yoga with vertigo? Um, they have to be very careful when they move, especially when they move their head. It will be a little messy problem. So they have to be very careful. I suggest them sit in bed and practice, not get up and do very vigorous exercises and things. I don't suggest them, but there are many simple techniques that you can learn and do it. Maybe the question and answer session, I would answer that. So now we'll go for joint mobilization. Joint mobilization, first one is neck. So the neck movement, you can keep, also very important, your leg placing in the, uh, I have to show you, yeah. Leg has to be kept it apart, not close. Keep it apart. Keep it apart for at least 1 feet. Come on. Then you can keep your hand over your waist. Okay. And legs always away. Anytime, even when you talk to somebody, keep it leg apart. Especially if you are above 60, keep it apart. Because that gives better stability. You don't fall. So it's very important to keep the legs little apart and then practice in standing posture or any yoga or any exercise. Even if you talk to someone, keep the leg apart. So you can prevent some fall. Even while taking bath in while shower, always remember this. This gives you better, better stability. And now we'll go for our neck movement. You can keep the hand over your waist and put your head down, and chin should touch to your chest and look up. Flexion and extension of your neck. A simple words, down and up. Don't close your eyes, especially those who have vertigo or synco or any other related issues. Please don't close your eyes. You can open your eyes and practice this movement for 5 times. 5 down and 5 up, down, up, down, up. Yes. If you have done 5 rounds, take a small rest because you don't overstrain. Okay. Just take a break. When you take a break, you can focus or think about your neck joint. How does it feel? At least that thought should come in your mind. So you're involving yourself doing it. Even after doing it, you're involving and you're observing. Always look towards. Is that the small step that you can take? Second moment. You don't keep your hand here now because it will restrict your movement. So you can tie the hand back. And you should simply look towards your right side, left side, right, left, right, left, right, left, right, left, right, left, right, left. Back to neutral position. Neutral position is how you do look at others. Done. Now close your eyes for some 30 seconds and understand what changes. Okay. We can go for third movement of your neck. Third movement. Bending towards right. Ear to shoulder. Maybe you see me in screen in opposite direction. I'm bending actually towards my right. Left. Right. Those who have neck pain, they should not strain. They should just do in their pain limits. Once it is hurting, you should stop in that angle. You should not strain more. 4, 4, 5, 5. Done. Now, you need to be very careful for the next moment, but take a break. Just 15 seconds. Close your eyes and count till 10 to 15. When you close your eyes and relax, you just observe your neck joint. What changes that you can feel. I know there will be a lot of disturbance, mobile, family, here, that. Minimize that. Try to learn things from the online session. Now, next, you need to do a clockwise direction of your neck and their head. It's not an anatomical movement, but just normally we do that. Clockwise rotation. 1. Just do it 3 times. 2. 3. You should open your eyes and do it in a reverse direction. 1, 2, 3, and neutral. So almost you have done with your neck joint. You will literally feel the difference of in the early morning. As soon as you get up, your joints will be a little stiff and rigid because you are in a position for 8 to 9 hours sleeping. So the muscles will be a little rigid and stiff. not too much. So very narrow way. So that you can even feel the difference. Now you may not feel that difference of practicing because entire day you were looking at the monitor, you were working, you were involved in activities. All this is very mobile. I mean, moved a lot. So doesn't make big change. So now neck is over. That part is done. I'll repeat up and down, sideward, sideward bending, rotation. So four movements you have learned for your neck. Okay. Now you have to learn some movement for your shoulder. So systematically you can stretch your hands and bend and bring it front. So the should touch each other in front and then lift it close to your ear and rotate. With this, do circle. That's what exactly I mean. You see once more, then practice. Lift it and rotate it. Okay. We'll practice together for 5 rounds. Raise your hand, bend your elbow, bring it in front, lift it up. 1. It should touch in front. I know many of them will not touching. 2, 3, 4, 5. Good. Can release and rest. Now you have to do it in opposite direction. Stretch, bend, we'll do it together. Bring it in front. We did it this direction. Now down. Make a big circle with this like this. Bring it here. 2, 3, 4, 5. Done. Relax. Next movement, your elbow. These things we can learn it very quick and it doesn't require much uh, thinking, just simple movements. Hands in front, turn it up. 1, 2, 3, 4, 5, 6. Done. I did one extra, 6. And also there is another movement, just this supination and pronation. This. You can do that as well in the morning. 1, 2, 3. Now, fourth one is wrist joint. Flexion, extension. 2, 3, 4, 5. Done. Nothing more. Fifth joints, I collect all the small joints. 1, 2, 3, 4, 5. Done. So we have done neck, shoulder, elbow, wrist, and small joints. And now we have to do another one, which is our spine. Little tricky. Again, I always like to remind you, the feet position is 1 feet apart. 1 feet apart. Okay, 1 feet apart, and then stretch your hand like this to come flip forward. Then twist. One, two. I'll slowly do. Three, four, five, and six. Enough. See, just this. When you do that, your feet position, it should not go this way. It should be straight. Very important. When you do this, only the trunk, upper part is twisting. Okay, fine, good. Now you may not see my head, have to see my knee movements. Okay, so in the knee movement, you have to lift one knee. You can also support your hand like this, otherwise, support on your waist. Just flexion and extension, especially in the morning. Those who, okay, lift, flexion, extension. 2, 3, 4, 5, 6. Enough. The other leg. 1, 2, 3, 4, 5. Enough. And relax. Last movement. I'll do ankle and toes together. Just this. Toe standing. It is one of the best exercise for your calf muscle. I'll just do for you to see. I will just do it like this. It has to be in the same line. 1, 2, 3, 4, 5. The same thing, you can have wall support like this. Wall support. Those who are aged, especially older population, they must do this. If you don't do anything, it's fine. You must do this calf muscle exercise every day 100 times. It's very easy to do 100 times. See, 10 times to do to lift your body up with the support. You need 10 seconds. Done. Then you do one more 10 after walking and one more 10 after walking. So 30. When you get up from your bed, you do this 30. Then in office, sometime after getting up, keeping the hand over the table, do some 10 times. And sometimes in the evening, do 10 times, 10 times, 10 times. So morning, noon, evening, and night. There is no problem. Total you do 100 times. One of the best simple exercise for your calf muscles. As you know, calf muscle is our second heart. Have to put a lot of calf muscle contraction to pull the blood up. So, which is really a good exercise for your calf muscles. So we have done all the joint movements. I will explain it to you once more time. Head, neck, shoulder, elbow, wrist, small joint, spine, ankle, knee, ankle, and toes. And then calf muscle exercise. Those who are above 45, you should spend just 10 minutes to do your calf muscle exercise. I'll tell you the benefits later on in the channel as a video. But this you must do. The benefit I'll explain, but you should keep practicing. Okay, last 5 minutes. We have only 5 minutes. I almost took your 10 minutes in talking itself. We did very less. It's okay. The first day is like this always. I don't know how much you are used to practice and things, but this is learning process. Please take it as a learning process. Now you just have to listen to me. You will not see me. I will close the camera. You just have to listen. Before that, what you have to do is lie on your mat. Lie on your mat. You have to stretch your legs little apart. Put the elbow and lie on your mat, which is Shavasana. I don't think I need to teach Shavasana to you. Most of the people know. Then when you get up, you have to get up like this and come up and then sit. Okay. Now you have to lie on your back. Now you will not see me now. You will just hear my voice. You don't need to see me now. You will just have to listen to me. So we are going to practice called a relaxation technique. Relaxation technique is after any exercise or yoga practice, last 5 minutes you will rest. After rest, you get up and then you do your regular activities. So to do this rest, you have to lie on your bed or you have to lie on your mat. You do that, then I'll start. I'll give you 10 counts to do lie on your back. And after the session, we'll give some 10 minutes for your questions. You can type and send, I can reply you. But lie on your back. Lie on your back. Legs little apart, hands away from the body, eyes are closed, and you are on supine rest. It's called supine rest. Now you will listen to me, you will not hear me. You will hear me, you will not see me. Lie on your back. Now you have to just focus on your breath for 10 count. 10 count. Focus on your breath for 10 count. Means inhale and exhale for 10 rounds. Slow inhalation and exhalation for 10 rounds. Now, once you finish this 10 rounds, you should focus on your abdominal movement. You just keep visualizing your abdominal movement, up and down movement. You can also notice that the movement becomes slower and slower. Once you've done that observation of 10 round, keep focusing. Now I would ask you to do a task, which is when you breathe, you observe or visualize the abdominal movement. As you inhale, the abdomen bulges up, and as you exhale, it sinks in. You focus this on 10 rounds. As you inhale, your abdomen bulges up, and as you exhale, it sinks in. Focus on this for another 1 minute. Now you know your breath rate, your respiratory rate, all has come down, very normal. Now slowly you have to get up by from your side and sit in any comfortable position with closed eyes. You have to get up, don't go for sleep. You can sit in any comfortable position, making your back and neck straight, eyes closed. The similar way, what we have done in the beginning, rub your both the palms, make it warm, and keep over your eyes. Give a gentle massage over your face, your neck, and slowly open your eyes. Thank you very much. Thank you very much for joining with us for this online training. We will see you tomorrow, 6 o'clock. It will be YouTube Premier Living. There will be some more people involved. And if you have any doubts, you can type. I know many could not join because they expected the WhatsApp messages also. They could not join. We'll do that needful. We had some technical issues here. So, any questions you can please ask. I can answer right away. Also, you need to understand it's not a session, it's a training. Training and session is different. It's a training that you learn and then you do your own. So, it's a training session for you for another 15 days. I think we have crossed little more time. It's time to say bye. But make sure you don't go eat all of a sudden. Take some time. Take some 30 minutes, 45 minutes gap, and then you can go for your dinner. Bye. Signing off by Dr. Arun Thejaus, and the program is organized by Nitte Center for Integrative Medicine and Research, Nitte deemed to be university. And thank you for everyone joining. We'll see you tomorrow, sharp 6 o'clock. Bye.